computer. It is, however, how employers can reduce costs while improving employee health. We hear from companies all the time, big and small, across every sector, that people are your number one driver for your overall company performance. And managing the healthcare costs are a huge factor in running your business. But even more importantly is making sure that your employee health and well-being is a high priority as well. So if an employer can reduce cost and improve employee health, that is the definition of a win-win. And these types of win-wins are why so many people are investing in healthcare innovation. I'm really proud of the work that's happening at the University of Texas and Dell Medical School. It's why voters agreed here in our community to tax themselves to create the school. And what we got was a school plus transformational healthcare. And you're going to get some insight into that today. Thank you for joining us today. A special shout out to Scott Wallace. Scott, thank you. Scott reached out to me a couple of months ago and said, of all the times when we need to be focused on healthcare and innovation, now is the time. And so thank you, Scott, for doing that. And welcome to the program. Scott is with the Value Institute for Health and Care at the University of Texas at Austin, and he has helped us to put this program together. I also want to thank the following partners whose support helps provide excellent programming for all of us all year long. Thanks to our pivotal partners, our foundation partners, a whole host of corporate partners. Thanks to all of you guys. And I'd also like to thank the sponsors that made today's event possible. Our presenting sponsor for the Economic Recovery Series is Dell Technologies. I want to do a special shout out to our foundation sustainers and to our corporate sustainers. And the sponsor for today's event is Ascension Seton. And speaking of Ascension Seton, I want to welcome Ted Hatton, who is the Chief Operating Officer for Dell Seton Medical Center at the University of Texas and Ascension Seton Medical Center here in Austin. Tad joined Ascension Seton in 2015 as the Vice President and Chief Operating Officer of Ascension Seton Medical Center Austin, which is the largest hospital within Central Texas's largest healthcare system. Prior to Ascension Seton, Tad spent 7 years as Chief Operating Officer for St. David's Round Rock Medical Center. And there he was part of an executive team that achieved Level 2 trauma certification and had responsibility for several major construction projects. So he is seasoned in our community and our community issues. He also serves as the Chief Staffing Officer and Ethics and Compliance Officer. Tad, thank you so much for being with us, and I will turn it over to you.
Thanks for that introduction, Laura, and thank you for the Greater Austin Chamber of Commerce today for putting on this event. It's an honor to welcome you today to what I know will be an informative discussion about the movement towards value-based care and why businesses are turning towards the new model to improve their employees' health and well-being. As you know, our healthcare landscape is rapidly evolving, and this includes how we approach care delivery and how we're paying clinicians for the care they provide. Traditionally, fee-for-service models have been the norm payment model in healthcare, but this model pays clinicians for the quantity of services that they deliver. But today, the government, commercial payers, and now employers are turning towards a new healthcare delivery model that prioritizes quality of care delivered over quantity of services provided, reimbursing clinicians based on improved patient health outcomes. This model is what we call value-based healthcare and is quickly on the rise. In fact, almost 60% of the healthcare payments in 2020 stem from value-based care contracts. These arrangements incentivize for quality care delivered with new value-based codes, risk adjustment reimbursements, and place an emphasis on social determinants of health. Heightened consumerism and competition are also driving this movement towards value-based care. Today's patients desire greater customer services for their providers, convenient care close to home, and are seeking non-traditional care methods. Now more than ever, we need to continue to find new ways to meet our patients' growing needs. By 2030, it's predicted that 20 million U.S. adults will be living with one or more chronic conditions. Clinical care alone cannot improve this population's health. We need to place a greater emphasis on the quantity and quality of care delivered and treat our patients' health holistically by taking into account their social and economic factors like their job, where they live, and if they can get to and from their doctor's appointments. Value-based care models give us an opportunity to rethink how we approach care delivery to better serve our patients. They also open the door for us to have more collaboration of data between providers, robust continuous improvement activities, and can shift our healthcare culture to one that's more patient-centered and personalized. So now it's my pleasure to introduce Scott Wallace, the Managing Director of the Value Institute for Health and Care at the University of Texas. Scott's going to talk to us today about the importance of employers taking a proactive approach to improving health, resulting in greater employee satisfaction, improved productivity, and reduced healthcare costs for the organization. So now over to Scott.
Thanks, Ted. It's great to join you, and thank you, Laura, for the introduction and the opportunity, and to the remarkable team of folks at the Chamber who it's fun to get a chance to talk with you, and hopefully this will be helpful in your thinking about how you run your business and how you take care of the people who work with you. So I want to start with a really personal question, and forgive me for the impertinence of it, but how good is your doctor? Although I work there, this isn't an ad for DelMed. It's a real question. Do you know how good your doctor is at improving your health? To be clear, I'm not asking if you like your doctor. I'm also not asking if your doctor is well educated. I'm asking whether you know if the health results of your doctor's patients are superb, good, mediocre, poor. I'd be willing to wager that you don't know how good your doctor is, because it's very likely your doctor doesn't know how good he or she is. The scary reality is that almost no physicians track the health outcomes of their patients. Neither do hospitals or clinics or pretty much anyone involved in healthcare delivery. So think about that for a second. They don't track their results. Research suggests that significantly fewer than 10% of all orthopedic surgeons track the outcomes of their patients after surgery. Just for the record, that's a pretty easy thing to track. You know, Mrs. Jones, hi, this is Dr. Smith. It's been 6 months after your surgery, and I wanted to see, are you still able to walk? Now, to be fair, most physicians ask about how their patients are doing, but they don't measure those results in any systematic way. And as every person in business knows, you can't improve what you don't measure. This isn't an issue about customer satisfaction. This is asking a really fundamental question, whether the care that was delivered achieved its purpose of improving health. And it matters a lot because the results of different doctors, different care teams, different organizations differs by a lot. Here's just one example. Teams of researchers looked at the rate of complications occurring in men after prostate cancer surgery. They looked at the results in Germany because, unlike in the US, in Germany, the results are systematically tracked. And what they found was that the results at the best center in Germany, a place called the Martini Clinic, were really different. Men having surgery at the Martini Clinic were 5 times less likely to have common complications, things like erectile dysfunction and incontinence, than men having surgery at the average facility in Germany. Less than 1/5 the rate of complications. This is shown in the second slide in your handout. So I'll start off by reiterating, almost none of us, including our doctors, knows how good our doctor is at improving our health. So if you have questions, feel free to just put them into the chat, and as I get through each one of these points, I'll stop and we can, have a little bit more of a discussion, as much as one way goes in a discussion. So that brings me to the second point I wanted to be sure to leave you with, and that's that the biggest issue in healthcare is not spending, it's health. Now, I realize all of the headlines are about spending, about what you as employers spend on premiums, about what your employees spend in out-of-pocket and copay, what the government spends on Medicare and Medicaid, and that matters. But the reality is that spending is a symptom. The cause of spending is poor health. And the only way we're going to get a handle on spending is by fixing the underlying issue. We need to be sure that care improves people's health as much as possible. So let me break that down a little bit. Why do people go for care? Usually it's because something is wrong. Their health is negatively impacted or it's threatened and they want help. Now, it follows that people don't generally go for care if nothing is wrong. Think for a second and you'll realize this is true. Do you know anyone who has gone for an extra colonoscopy that wasn't needed? I kind of doubt it. So people go for care when they need help. And to say that a little bit differently, poor health drives spending. Poor health is what drives spending. So here's another example. We studied Commonwealth Care Alliance, a nonprofit health plan and care provider in Massachusetts that focuses on elderly, frail, poor people. So really old, lots of chronic conditions, economically severely disadvantaged. These are people who qualify for both Medicare and Medicaid. Most of the people at CCA are eligible under federal guidelines for admission to a nursing home, but they get care from CCA because CCA works to keep them safely at home. Now, you would expect that people who are old, frail, and poor would be expensive, and you'd be right. Under conventional care, the government was spending about $15,000 a month on their care, $15,000. Why so much? Because these people were in and out of the hospital all the time. They often didn't have a primary care doctor. When they did, they often lacked transportation to get to an appointment. Their poor health was driving a lot of spending. And that's true for all of us. Think of the last time you got the flu. You go to CVS and buy your Robitussin and your sinus medication and all that stuff. You spend a lot more than you spend when you aren't sick. So it's clear that poor health drives spending, but it's also clear that effective healthcare that improves a person's health, can dramatically reduce spending. So back to my example of Commonwealth Care Alliance. CCA built a model of care specifically for old, frail, poor people. It involved home visits, 24/7 access to a nurse practitioner, a care team that addressed things like nutrition, exercise, home medical equipment, the whole deal. We discovered that some of the CCA caregivers were actually dyeing their patients' hair so that the women felt comfortable going out and being sociable. And what was the result of all that extra care? Spending went down by an average of $6,500 per person per month, almost by half, even after paying for all that extra care. Why? Because they were paying for different care. They were paying for a lot of services, but they were very inexpensive services that delivered a lot of benefit to people, as opposed to paying for very expensive hospitalizations that really were very limited in their benefit. So a 50% reduction in people going to the hospital and a 35% reduction in readmissions when they did have to go in. CCA offered different care that was more effective. It allowed people to live safely in their homes. So let me bring this conversation from old, frail people to your employees. Their health is driving your spending. Research shows that employers spend between 3 and 7 times more for the costs of employees' poor health than they spend in benefits. 3 to 7 times more for the cost of poor health than for benefits. How can that be? Think about disability and how much it costs you when an employee is disabled. Now think about early retirement and the loss that imposes on you and your company and your colleagues. How about absenteeism? Extra overtime, missed deadlines, strain on you and other people there. What about presenteeism? People showing up but not really able to work. How much does that cost you? So the takeaway is this. The biggest cause of healthcare spending is poor health. And despite all that spending, healthcare isn't delivering good enough health improvement. So again, I'll pause. If you have questions, please put them in the chat. I'm glad to address them as we go through this. And sometimes it's more helpful if you're thinking about something to get an answer to it. So let's take a look at what's been done about the problem to date. What you spend on healthcare is the product of two variables: how many services your employees are using, multiplied by the price of those services, volume times price. You'll see this on the third slide in your handout. So most of the focus in healthcare reform has been on only one of those variables. It's been on the price of services. Think about all the recent efforts on hospital price transparency, new federal rules that require hospitals to post the prices of their services. Ignore for just a minute that those prices, those list prices, are incomprehensible. But even if you could understand them, would it really matter? Price is only half the equation. If we don't know what health outcomes we're getting for the price, then we're just shopping on price, and that doesn't make any sense. We just learned, remember the Martini Clinic conversation, that outcomes vary by a lot. So if we don't know whether we're getting great outcomes or terrible outcomes, we only know the price, how much good is it to just knowing the price? Fundamentally, this was the issue behind the failure of Haven. Remember that healthcare business that was started by Warren Buffett of Berkshire Hathaway and Jamie Dimon of Chase and Jeff Bezos of Amazon. Their 18-month endeavor failed because all it focused on was the price of services. It didn't try to solve the problem of getting better health outcomes. So let's go back to that equation: cost equals volume times price. How do we reduce volume? One way, obviously, is just ration care. Make it really hard for people to get the health care that they are seeking. And we've done that in various ways for 30 years. Remember managed care and all of that. Or you can increase copays. You can use prior authorizations, on and on. The tricks are endless. But we all know that rationing doesn't work. It might stop people from getting care at one point, but if their health doesn't improve, they'll be back and probably be more expensive when they come back sicker. So how do we reduce the need for care? The answer, I think, is really clear: make healthcare more effective. So here's another example of that. At the Cincinnati Children's Medical Center, a group of psychologists got together to try to improve care for kids with obsessive compulsive disorder. And those psychologists came up with a really simple measure of whether the kids were making progress against the condition. It's a single sheet of paper on which the kid marked whether he or she was in control of the condition or whether the OCD was controlling the child at home, at school, with his friends. The graphic that they used is that really cool green and yellow sheet that's in your handout packet. Using the results of that single measure, they realized that a particular form of cognitive behavioral therapy was, by a huge amount, more effective at treating OCD. So they retrained all of their psychologists, and they all started measuring and using this one method. The result was dramatic. Among other things, they were able to get kids out of the diagnosis of OCD faster. They had 95% of the kids in control of OCD in 12 therapy sessions, and previously it had taken 21 sessions. They reduced the need for care by 43%. So the takeaway is this: if we're going to change the trajectory of health spending, we have to be sure that the healthcare we're buying achieves the purpose of improving the health outcomes that matter most to people. Better health reduces the need for care, and that reduces spending. So I'm going to take a break here because there were a couple questions that popped up. Do these costs include both physical and brain health? What are your thoughts about how the pandemic has impacted health? The pandemic's a huge thing. It's impacted everything in lots of ways. But I think what it's really said in terms of employers is we got to double down. We have to really think differently about how do we protect and build the health of employees. Because, I mean, I'm sure you've all seen it. We see it with our team. The strain of the pandemic has everybody about up to here. And we need to help people to lower that level. And I think that's incumbent on everybody, employers as well as the health system. The other thing I think the pandemic is going to do is really change the approach of employers to public health. There's sort of been this bright line between public health and private health, and things like monitoring or the broad-based testing that we needed for detection of the COVID pandemic was always seen as a public health function. But employers are realizing now that they need to be able to do that sort of thing here. Oh, okay. I'm sorry. The handouts won't get to you until the afterwards. So you'll see all this once you get your packet. So let me keep going on this, and then I'll go back to the questions about the pandemic when we get all done. So we ended up talking a little bit about the need to reduce the need for health, for care through better health services. So now I'm going to kind of geek out on you, but I promise only for a second. I'm a professor at UT, and if I didn't geek out a little, they'd take away my union card. So I work on improving value in healthcare. In fact, all of my colleagues at the Value Institute work on this issue. And value, as Tad pointed out, has become a really popular theme recently. But I want to make sure we're all in agreement on what it really means. So when we talk about value at the Value Institute, we talk about the change in health outcomes that matter most to patients for the cost. And when you get your packet, you'll see that in your 5th slide. It's value is the change in outcomes divided by the cost. And there are lots of reasons that we like that definition. First, it aligns with the purpose of healthcare, better health outcomes. That's why people go for care. Second, it looks at whether we have changed those outcomes, made a difference. It's looking at the change in health outcomes. Again, that's the purpose of care. And third, it recognizes that, as we saw when we looked at volume and price, the most effective way to improve healthcare value is to dramatically improve health outcomes. If we eliminate the need for future care, we can really lower the spending. So today I want to get you to think for a minute, though, about a specific part of the value equation, which is changing the outcomes that matter most to patients. This is a big problem in healthcare for several reasons. First, it's pretty rare that care teams really know what outcomes matter most to their patients. Second, as we've already discussed, we aren't tracking outcomes, so we don't really know if we've improved them or not. And those issues drive a lot of the wasted spending in healthcare. How does that happen? Well, because the health system is working on things that people don't necessarily care about, and because we aren't talking to patients about what matters most to them. Often, as a result, our care just isn't as effective as it could be. So let me give you another example from our research. We spend a lot of time talking to people about their health and what matters most to them. We also talk to a lot of caregivers, and we've noticed some really major disconnects in there. One of the most glaring disconnects is in the care of people with type 2 diabetes. So late onset diabetes, it's often called, compared to type 1 juvenile diabetes. So while type 2 diabetes has a whole lot of genetic dimensions, it is usually associated with lifestyle factors around weight, diet, and exercise. That means that many, if not most, of the people with type 2 diabetes could get out of that diagnosis if they could more effectively manage weight and exercise. But they don't, and we all sit and wonder why. Play blame games and all kinds of things. But one of the things we've discovered is that care teams and patients are worried about different things when it comes to care of type 2 diabetes. Care teams worry about big biological issues. Kidney failure is a huge issue, and untreated diabetes will likely cause kidney failure in most people. So doctors and nurses worry about it, and they talk to patients about kidney failure. It's a bad outcome. We want to avoid it. But here's the disconnect. Most people with type 2 diabetes aren't thinking about kidney failure. It's somewhere out there in the future. I mean, think about it. Not many of us think a lot about our kidneys. So it's not top of mind that they might fail. Know what is top of mind to people with type 2 diabetes? Sexual function. When we do our research talking with groups of people with this condition, erectile dysfunction or other sexual dysfunction comes up in the first 10 minutes. Every time. It's top of mind to people, and it's very, very common in people who are suffering from advanced type 2 diabetes. Now, the care of somebody with type 2 diabetes is pretty much the same, whether the goal is preventing kidney failure or ensuring sexual function. So what's the problem? The problem is that by focusing the conversations on kidney failure and not focusing on sexual function, caregivers don't connect with their patients, and patients then don't engage with their care. We're spending tons of money on care that isn't working. So that's why we need to start understanding, as employers who pay for care and as providers who offer care, we need to start understanding what matters most to patients. So I'm going to go back to questions for one more second before I finish up on the talk. Is there low-hanging fruit you suggest employers immediately begin looking for? Yeah, that's what I'm going to get into in this next section. What do you do about all of this? And that really the last point that I want to leave you with is what should you be doing now? How can you, as an employer, whether you're really small or very large, how can you fix this? How can you do something? And when we first started talking about this webinar, we talked about the idea of employer nihilism. Employers just think they're stuck in this thing and there's nothing they can do about it. And that's wrong. There are things you can do. So the answer, I think, is to start operating with a health strategy. A health strategy. Take a proactive approach to your employees' health so that you impact how much you're spending. How to do that. So let me share a framework with you that I've developed together with my colleague, Elizabeth Teisberg. This framework for employers to create, this is a framework for employers to create an effective health strategy. And it has 4 parts. Again, you can see it, it'll be in the slide handouts that you get. So first, you have to understand what drives poor health for your employees. Now, you can get this information from your insurance carrier or from consultants who analyze your employees' claim. You'll find out, are your biggest expenses coming from back and joint pain? Are they coming from stroke and cardiovascular disease, from type 2 diabetes, from something else? What is driving poor health for your employees? You need to know what's driving your spending, which means you need to understand what's causing poor health among your employees. And be aware the drivers of poor health among your employees are probably different from those of other employers. What we see is that they really group by company. Sometimes by industry, you'll see people who have employees doing a lot of manual labor will have more joint and back pain and that sort of thing. But think about it in the context of your own employees, because they're not all going to be the same employer to employer. So now comes the proactive part. Here's how you can start to do something about it. Think about and create programs for improving health at work. You have a lot of options, even in the remote settings that we're in now. Can you address ergonomics? Or is that the cause of back pain and neck pain for people? Can you get people moving more during the day? Can you change the food options or find ways to encourage better diets, at least at work? We worked with one employer whom we convinced to begin offering nutritious take-home dinners at its employee cafeteria. They already had a cafeteria, so the marginal cost of making this option available was really pretty low, and it solved a big problem that their employees couldn't find to-go food that was nutritious and healthy for their families. Okay, third part of the strategy. Know what's driving, now that you know what's driving poor health among your employees, can you craft your benefits so that they address those issues? What are you paying for that isn't helpful? And what should you be making available that's missing? When you put yourself into the shoes of your employees, are you really getting benefit from your benefits? A lot of times they're not very helpful. Are your benefits changing health for your employees? It's something to really look into, because if you just take a one-size-fits-all health plan, and if you're telling your employees over and over, yeah, our health plan doesn't cover that, yeah, our health plan doesn't cover that, it's probably telling you that you got the wrong benefits for what your employees need. So fourth, what can you do to ensure better health options for your employees? If your analysis shows that your employees are having a lot of back and joint pain, are you sure they can get effective and efficient care? Now, this is a little bit of a commercial message. UT Health Austin has an incredibly effective joint pain clinic that helps people restore function and capability. It offers solutions, not just surgery. But as employers, we need to get you thinking more about what is it that you're paying for the care of your employees. You need to be more than the dumb money in healthcare. You need to ensure that what you're paying for is getting better health outcomes for your employees. If you're on a hospital board, push them to measure meaningful outcomes and publicly report the information. If you have a bunch of employees with type 2 diabetes, get involved in helping them find a clinic or even an individual doctor who will provide tailored, effective care. We spend a lot of time with employers on this work, and I won't profess to be able to solve all the issues for you in 32 minutes. However, I hope that you'll start thinking differently, more proactively about how to strategically approach the issue of employee health. So that's the end of my formal talk. I would be really happy to get questions and interact more. There was one question that somebody put up about whether we have recommendations on what we look for when we transition back to the office. What can we expect? I think that's a multi-million-dollar question at the moment. I think we can expect a lot of stress, and stress is a real thing. It's physiological. It's not just squishy emotion kind of thing. It has huge physical consequences. So I think gearing up the support functions around that are going to be really important. I think you're also going to see that many people have been delaying health. In looking at the impact of the pandemic, we look at what's called the excess death rate. How many more people have died during a period of time than all of the models would have predicted would have died during that time. Right now, the excess death rate in the US is up about 23%. It's a huge number. That reflects in some measure the fact that people aren't getting routine care. Lots of people aren't going in for heart disease and lung problems and all of that. So we're seeing more mortality from that. I think as soon as we get back to a normal, you're going to see a lot of people starting to go in and get more routine medical care. So I think that's going to be the other big surge. I don't know if there are more questions that people have. I don't see a lot of them popping up here. I think the thing that I want to make sure people leave with is a sense that this healthcare isn't something you're stuck just accepting. I think a lot of employers are in a mode of saying that they can't change anything about healthcare, and that's just not right. And the reality is individuals really struggle to change anything about healthcare, but employers can do a whole lot. Question came up about telemedicine in all of this. Could it be a big breakthrough? Telemedicine is one of the true silver linings of the pandemic. Most estimates that I've read talk about a 10-year rate of adoption in the last year. Telehealth has been accepted for all kinds of things. And again, this is a place where I think employers can play a really proactive role. Does your health plan cover telehealth services? We have a colleague who is an oncologist, cancer doctor, who has gone to doing 60-70% of his visits online. And he said, my patients are undergoing care for cancer. They're getting chemotherapy. They're recovering from surgeries. Having them come to my office so that I can read through their lab results and see them doesn't make any sense. I would prefer for them to just see them through video. And that's becoming more and more and more useful. And I think that's going to be a big opportunity. I will say Seton has done a great job in expanding their telehealth capability, as has UT Health Austin. So I think most of the providers now have something that's available. Employers, the question came up about whether employers are establishing group exercise programs. It's been interesting to see more effort by employers toward more kinds of fitness that fit more different people. So, the early trend in this was, we're going to sponsor a 10K, or a half marathon, or God forbid, a marathon. And that's great for the sort of 20-somethings, maybe the 30-somethings and a few of the 40-somethings, but is that really going to serve a lot of people? We saw in one community, it was actually in Cleveland, that they started a program that allowed people to walk around the Cleveland Indians stadium. And I thought that was kind of a cool way to sort of come together. I think it would be a great idea. The caution on the exercise programs in that is, one, to be inclusive, and two, figure out how you're not just paying for things that people would do anyway. One of the things that happened early on was that employers said, we're going to pay for gym memberships. So they paid for gym memberships, and all the gym rats got free gym memberships, and nobody else went. So make sure that it's something that your people want to do and will use. One of the major challenges, the question that came up, one of the major challenges that employers face is employee engagement. Do you have any examples? Yeah, this is an issue that we confront a lot in the master's program that we teach on healthcare transformation. This question of, do people really care about their health? And I think they do. I also think that the healthcare system makes it really, really hard, and work schedules and all the rest make it really, really hard. So I'll give you an example that led to this this company that started making take-home dinners. And it's a big employer. They have a whole building, they have a whole floor that's a cafeteria. It's not an option that's available to everybody. But what was behind it was that we were talking with their employees and talking to them about what did they do about their own health. And I remember one woman who said, she said, let me tell you the story. I'm a single mom. I have 3 kids at home. As soon as I get off work, I need to be shuttling them to ballet and soccer and all the other activities. And on my way home, I pass 3 places where I can get dinner. I pass Kentucky Fried Chicken, McDonald's, and a Wendy's, or I don't remember what it was. And she said, I've worked out the best meals that I can get nutritionally for my family at each of those restaurants. And that's what I do, because that's what I can do. I don't have time to do something else. I think if we're going to get employees engaging in their health, we have to show them that it's important to us, that it matters to us, that we care about them as individuals, and find ways that groups do things together. We've seen one of the really effective things that organizations do is they have team-based weight loss competitions. So 30 employees get together on a team, and the way they do their weigh-in is not individually. What they do is they gather at the loading dock, and they all get on the shipping scale together, all 30 people. And they track their weight loss as a team so that they're not stigmatizing one person. And they have the flip of that, they have the support of everybody going in it. So I think it's a really important thing to do. Somebody said, thank you for your perspective and pushing on this opportunity responsibility. One of the major challenges that employers face is engagement. Oh, that's what we did, okay. Could you change or add one thing to the average employee benefit package, insurance, PTO? What would it be? I think you ought to think about, can you change 5 things in your package? And I think that the answer is, it depends on what your employees really need. If you have employees who have a lot of back and neck pain and are, a lot of joint issues, maybe you add massage therapy as a benefit. If you've got a bunch of people who don't have that problem, adding that benefit doesn't really do anything. And so this idea that there's one solution that's going to fit everybody is really the antithesis of strategy. Strategy is about being different. And strategy is about creating value for the people that you serve. In this context, the people you serve are your employees. How do you create value for them? You need to talk to them and ask them and dig into it a little bit to find out what benefits would really be beneficial. We've seen that happen over and over and over, that employers act as a single direction. Everybody goes for health club memberships, everybody goes for Weight Watchers, and that doesn't really make sense. I think it's got to be a lot more tailored to what are the needs within your group, because responding to those will create value for your employees. Things like telecommuting options. I think all of that's going to become just routine, and it will change the health equations a lot, but hopefully in a beneficial way. I know for myself, I'm saving an hour and a half a day that I don't spend in my car commuting. We've gone to doing a walk every day. Can you find other ways like that so that we don't just take that extra hour and a half and have everybody working 11-hour days when they were only working 9.5-hour days? So I don't know if there are more questions that have come through. I can only see myself, so. Okay, well, if that's all the questions, then I'm happy to tell everybody thank you. Please feel free to reach out to us if we can be of help, and please do get involved in your employees' health. Don't assume that there's nothing that you can do. There's really a tremendous amount that you can do, and the framework for an employee health strategy will be in the packets that you guys will get at the conclusion of this. If you have questions about it, feel free to reach out, and my email is in that packet. Oh, and there's our slide about the whole Value Institute.
Scott, that was really, really interesting. I can't tell you how appreciative I am for that. And we will make this available to all of our members. Folks that didn't get a chance to watch it today will get a chance to click on a link and watch it later. And I will tell you, for the record, while I love my colleagues, the only way that I would do group weight loss is to step on a scale all together versus individually. But some really great ideas, and thanks for pushing on us to be thinking about our employees in new and different ways, and making sure that not only their physical health, but their brain health is top of mind. So thanks everyone for joining us for this important topic. We've got some upcoming events. The Connect More is a midday mixer. It is April 8th from 1 to 2. On April 16th in the morning from 9 to 10, how higher education is kickstarting the Central Texas economy. I'll tell you what, if you are interested in how it is that we remain so successful as an economy, you're going to want to tune into this one, because having a solid talent, a solid pipeline of local talent is one of the big keys to our success. And then on July 22nd, we have the 10th annual Generous Business Awards. So lots coming up for you. Thanks everyone for joining us. Scott, thanks again for a jam-packed, information-loaded session. We appreciate you.